وسهلا بكل الذين ينضموا للاستماع إلى راديو بلدي أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا مع ليلى الحسيني في بث حي ومباشر عبر WNZK راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern, and American simulcast radio show. Radio Baladi is broadcast every Friday morning on WNZK 690 AM from 8 until 9 Eastern Time on Good Morning Michigan with Layla Al-Husseini. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues with your host, Layla Al-Husseini.
Good morning and thank you for being with us. This is Khalil Hachem, editor via Michigan.com, the fastest growing digital business magazine in the Middle Eastern communities in Michigan. This show is brought to you in cooperation between Michigan and US Arab Radio. Today is Friday, February 21st, 2020. The month is going by so fast and the weather is cold. Temperature could reach in the mid-30s later on today. Right now it is in the mid-20s. Protect yourself if you have to be outside. It is very cold. Thank you for being with us. The number here is 248-557-3300. Please give us a call should you have any questions or comment. There's a lot of news in the forecast today for this week, for next week. This month has been very busy. We're going to be starting with an issue that is very important to the community, and that's the opioid crisis. There's been a lot of meetings. I've attended a few. There was a meeting last week. The community is really grappling, not sure what to do with this issue, and we're not sure we're really dealing with it the right way. So today we're going to be talking a little bit about that. And with us, Dearborn Police Chief Haddad. Good morning, Chief.
Yep, good morning.
How are you today?
Good. How are you doing?
Wonderful. Also with us is Makki. She's the Director of Access, Community Health and Research Center, Chair of the Access 8th Arab Health Summit. Good morning, Ms. Makki.
Good morning. Thank you for having me.
Absolutely. Thank you for your time, both of you. Chief, let me start with you. This is a serious issue. There has been a lot of meetings. Where are we?
Here's where we're at. We all recognize that we have a opioid crisis that's probably bigger than anything this nation or the world has seen in recent times. There seems to be a lack of direction on which way to go. And quite honestly, given the fact that in America alone, about every 11 minutes, somebody dies from an opioid overdose, whatever solutions we offer are totally anemic to the issue. So you're right. We go to a lot of meetings, and awareness is a beginning of fighting this. But I think we have to come up with a comprehensive commitment to stand against opioid addiction in our city, in our community, in our country. We all know the hazards. It's ironic what they did with the coronavirus. They can lock down a whole continent, lock down planes, lock down boats, and yet this opioid crisis, in my view, is much more threatening to our country and to our world, and we seem very indecisive about a solution.
Absolutely. How does it affect the law enforcement side of it, Chief?
Well, any type of addiction generates crime to support it. So in that sense, particularly property crimes, auto thefts, stealing from stores, that kind of thing, those are on a rise and continue to, plague our community. And, the drug addiction problem is certainly fueling that. With the deaths, I think the entire community suffers a loss of a member. That's immeasurable. Pain, suffering, and the loss of a member that could otherwise produce something positive for the community. We continue to, try to apprehend people that are delivering the stuff, but those are complex, long-term cases, and obviously, given the supply chain that we have to go up against, it's a very anemic approach. When you stop and consider that 90% of all the opioids in our country are coming through legal ports of entry. Let me say that again. 90% of all the opioids coming into our country come through legal ports of entry. What kind of impact will I have on a traffic stop at 3 o'clock in the morning with somebody with a few pieces of drugs in his car? It's a monumental task, and the country has to take a much stronger view of that.
Absolutely. Ms. Makki, Access has done a great job serving this community. What are you doing now to really deal with this issue?
Well, as you know, Access has been doing this work now for decades, and we offer a wide range of services. We have a very comprehensive, holistic, wraparound model of care. We focus on individualized care, meaning we are very person-centered in our approach. And as the chief just mentioned, this is a huge problem, and we offer we have certified substance abuse counselors that offer individual, family, and group therapy. We have psychiatric medication evaluation and review, supportive employment, care support, case management. We have a primary care clinic that offers medication-assisted treatment such as Vivitrol and Suboxone. We've been doing Narcan training. That's a drug that's used to reverse an overdose. We have distributed over 200 kits to community members and family members of loved ones who are using drugs. We also have our Access Substance Abuse Coalition that focuses on community outreach, education, and awareness with a major focus on prevention among our youth. So there's a lot that's being done, but I think the problem, that we acknowledge at Access is that it's not enough to just see clients who come to us. We need more mobility and boots on the ground. The biggest problem that I see is that we do not have a detox center that is currently sensitive and appropriate to meet the needs of vulnerable populations. And I think what, national data shows that a 5% decrease in overdose and deaths, and unfortunately that is not what we are seeing in our community.
What do we see in our community?
We're seeing actually an increase in overdose and deaths, unfortunately. And even when individuals are seeking inpatient treatment, there currently is no coordinated effort for outpatient follow-up care. And what we are seeing is, although they're getting into inpatient, if there's beds, that is, and that's another problem. Once they're released, there's not that coordinated effort, and if they go back to the same environment, their tolerance level is low, and that's where you see the relapse occur and the overdose and death, because they go back to using the same dose, and that causes, unfortunately, overdose and death.
What should we do now?
Well, again, this is a huge problem, and that is why we at Access feel it's our responsibility to do more. Access plans to open a center that will help tackle this national epidemic with our unique blend of holistic services. It'll include both inpatient, detox, and extensive outpatient services. So in addition to all of the services that I mentioned, the center will offer yoga, meditation, acupuncture, social services, housing, legal, and much more. This is addiction is a disease, and recovery is a process. And what we are seeing is there's several levels of this recovery process. And the first level is that detox, and that's what's missing here. And that's why there's that lack of coordinated effort. And unfortunately, that's why we're taking that responsibility and hope to open the center in the very near future, and hope to decrease overdose and deaths in our community.
Yeah. Chief, you and I attend some of these meetings, and to me, it's starting to look like it's a photo op. Do you feel the same way?
I want to stop short of saying that, but, again, and we work very closely with Access, and I 100% agree with Mona that it has to be a holistic approach to this battle we find ourselves in. Yeah, sometimes the meetings don't produce a lot, but simple awareness to attendees is not going to help with the problem. We need people that will reach out to the masses, whether they're schools, whether they're places of worship, business organizations, and really emphasize staying off of the drugs in the first place, and secondly, giving them awareness where they recognize somebody that might be vulnerable to go on to drugs, opioids, and the sooner we can all work as a team to stop it from coming into our community and into our homes is what I'm talking about here, particularly with young people,
Sure.
because the ages are getting younger and younger with the deaths. I'm sure that Ms. Makki can confirm that. And, so the family unit, and then externally, schools, places of worship, places of employment, any type of a leadership position that the people depend on for guidance, for decision making, that opioid crisis should take front and center and should be a top priority to do whatever we can to, defeat it. And it is going to take a holistic approach. It is a mental illness. It's a disease. I think when you stop and look at the increased numbers of suicides of young people, behind most of them is the addiction issue. And there's a lot of other issues that, come into the community and into our society that sometimes are overlooked. But when you look deep, it's the addiction that caused them to commit suicide. They feel hopeless, bewildered. They really don't want to be in that vicious cycle. And young people can't deal with, issues. They end up committing suicide. And I think that's a tragedy in itself.
Absolutely. It's I've spoken, previously about a month ago, start doing some reporting on this, and I've spoken to a lot of families about it, and it seems like most parents have no clue what's going on. How do we educate these people, Ms. Makki?
And that's where our ASAP coalition plays such an important role. And I want to thank all of our coalition members. And this is a community effort, right? And like the chief said, it involves our schools, our faith community. All people in the community have to be involved in raising awareness and making sure that people know where to go to get help. I think that's the first important step, is making sure that people have the resources and the tools that they need. I do want to mention a collaboration with the Dearborn Police Department. I want to thank Chief Haddad and Captain Issa for this. We now have a substance use disorder advocate housed at the Dearborn Police Department. And to date, we have seen, over 130 cases, and over 30% are receiving treatment and counseling. And again, we just have to keep raising awareness. We got to continue this work and educating our community members. I mean, that's where it really starts. I remember, when we first started this work, people didn't know where to go, and people were scared of law enforcement. They were, insurance was an issue. How do we get our loved ones to get the help that they need? And that's when we started working with the Dearborn Police Department. We received numerous calls on a daily basis. And, just the stories are heartbreaking about what these families are going through. And one of the biggest issues is that, we need help. Our loved ones are, maybe they're being involved in crime and theft, but they're scared to call the police. And now, because of this partnership, they have access, to an advocate and a police officer who goes to the home, works with the family, and the ultimate goal here is to get that person into treatment. So, this is one collaboration that has, proved to be very, very successful. And we thank, the chief for this partnership. But But again, it's about raising awareness. We have to continue to have these conversations, and we simply cannot give up. And I think that's the role that we play at Access. We feel it's our responsibility, and it's unfortunate every time we hear of a case of overdose or death. It's like losing a family member. I mean, it's very personal.
Absolutely.
And again, it's about continuing the work and raising awareness and working with all community partners. This is something when they say it takes a village, this truly takes a village, and it takes each and every one of us to take responsibility in this issue.
Absolutely. If you could stay with us just for a little bit, we're going to take a short break. We'll be right back. Please stay tuned.
If halal is important to your family, you can trust that Miramar will offer not only the highest quality halal products, but the best tasting and healthiest foods that can be placed on your family table with confidence. Miramar is the first and oldest halal certified food brand in America, serving the Arab and Muslim community, and offers a wide range of halal food products. Check out Miramar's halal food selection today by visiting Miramar's exclusive distributor, Ziad Brothers Importing at www.ziad.com.
Rahma Worldwide Aid and Development provides humanitarian aid in several countries, especially in areas inside Yemen, Gaza, Syria, Lebanon, and Jordan, in addition to others in Africa and around the world. Rahma Worldwide provides food baskets, container shipment, medical supplies, mental health care, education, orphan sponsorship, soup kitchens, and more. Go to rahmarelief.org or call 248-990-4247. Any amount donated to Rahma Worldwide will go to sustaining many lives. Call now 248-990-4247.
انت حسن شايفك كم يوم قاعد حالك عن الي ساعة عم بستناك مشان نروح نتغدى بالشام. الشام؟ ايه بالشام ومو بالشام. شلون صارت هي؟ بدل ما نروح نتغدى بالشام ايه جابوا لنا الاكلات الشامية الطيبة لعنا لهم. وشلون بقى؟ هذا مطعم دماس عم يعمل كل الاكلات الشامية الطيبة هو. وطيبة؟ طيبة كتير. شرفوا نتغدى سوا بمطعم دماس.
الأكل الشامي الأصيل فقط بدمس كوزين. زوروهم على 28841 أرشد لك بفارمينغتون هيلز، ولطلباتكم اتصلوا على 248-987-4609. That's 248-987-4609. دمس كوزين and catering، جبنا لكم الشام لعندكم.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shama is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shama has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shama is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shama at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
Welcome back, and thank you for being with us. We're talking to Chief Haddad and Ms. Makki of Access. Chief, what would you like to see done in the community so we can get a handle on this issue?
I'd like a very overt commitment from our entire community to acknowledge the issue and to do something about it. I think in the short term, there's a couple of things that our community here in Dearborn should be aware about. And number one, we have something called a special needs register, and they can go online and sign up. If they have anybody in their home who has a mental fitness issue, it could be autistic, it could be any kind of dependency, it could be poor mobility, no sight, hard of hearing, they could put that down on a special needs register. And when we get a 911 call, be it police, fire, or EMS, we get a flag on that they have special needs. And that might be the difference of saving someone's life or knocking at a door and someone can't answer because they might be on the basement floor somewhere. The other thing we're working very hard with is our court to make sure that in those cases where we determine that addiction is the issue, we offer that subject an alternative to sign up in one of these programs. Our Veterans Court is very instrumental with that. But anytime we get a case where it's obvious that a person, admits to addiction or it appears to be that way, we try to offer them an alternative means in lieu of incarceration. And I think that's very important because we got to try to get them help or nothing's going to change for the better. So with those two things, I want our community to know that they're available, and our partnership with Access, if I could double it tomorrow, I will, and anyone else that wants to work with us.
Absolutely. Ms. Makki, what do families need to know?
Families need to know where to access services. I think that's the number one thing. And I think the biggest barrier right now that families, face is the stigma that's attached to addiction. And we need to work together, and we need to do more, and we need to do better at educating our community and letting them know that there is help and there is hope. We have 5 recovery coaches on our team that are living proof that recovery is possible. And again, we need to be together on this issue. And when we see a family struggling or we see someone out there that needs help, we need to step it up. We need to make sure that that person gets the help that they need.
Absolutely. So we need to do more outreach, basically.
We need to all be on the same page in terms of addiction and treating it as a disease and reducing that stigma that currently is attached to it. There's a lot of shame and failure attached to addiction. And, when a person who's facing addiction relapses, that again, we have to be hopeful and we have to, again, work together and make sure that individual gets the help that they need. And people need to know where to go, for help. And we're happy at Access, to be that liaison, to be that provider, to be that support that the families and individuals who are facing this crisis need.
Absolutely. Is there anything I haven't asked you, and how can people reach you?
They can reach us by calling Access, our mental health department, phone number 313-945-8138. And again, to reach out to help, and the help is there, and we're happy to help anyone who is in need. Whatever that may be, education, getting into an inpatient facility, providing our outpatient services, whatever that may need, we are happy to provide that service.
Thank you so much. I appreciate you taking the time to be with us.
Absolutely. Thank you.
Okay. Chief, is there anything I haven't asked you that you'd like to share with our listeners?
No, I just want to encourage people to take a firm stand and a commitment to eradicate opioids in our community. And to what Ms. Makki just said, they can also walk right into the police station and want to get help, and we can refer them. We've done that on a fairly regular and successful basis. We'll continue to train all of our police officers on the use of Narcan so that we can provide our community with every measure to give them that second opportunity. And unfortunately, there's times that we don't get to them soon enough. So we want everybody to do the very best to continue to fight this.
Is there a specific number they can call, or they can just call the 911, or which one?
If they want to do a referral, they can call the 943-3030 line, and they'll direct them.
Okay.
Or they can call the general number here, and there's always somebody to answer it.
Sounds good. I really appreciate you taking the time to be with us, Chief. Thank you so much.
Okay. Thank you.
I appreciate it. We're going to take a short break. We'll be right back. Please stay tuned.
مرحبا سعيد.
اهلا علا.
ليش هالمقابلة الفاترة هي؟ بيقول المثل لاقيني ولا تغديني.
يمه زعلتي، شنو رأيك إذا لقيتك وأيضا غديتك بأحسن مطاعم ميشيغان، مطعم عشتار؟
والله فكرة، أفضل الأطباق والمقبلات العربية والعراقية وأحلى ملقا.
ولا تنسين اللحوم الطازجة مباشرة من ملحمة عشتار لزباين عشتار. وملحمة عشتار توفر اختيارات متنوعة من كافة أنواع اللحوم وبأسعار متميزة وجودة أيضا مميزة. ملحمة عشتار تقع على 36865 راين رود في مدينة ستيرلينغ هايت.
وأكيد أحلى لمة وأطيب لقمة في مطعم عشتار اللي عنوانه 3625 15 مايل رود في مدينة ستيرلينغ هايت. هاتف 586-698-2585 586-698-2585.
يلا علا،
يلا عشتار للجودة وكرم الضيافة عنوان
مطعم عشتار.
When you're looking for the best in optical care, Dr. Imad Nakash is your doctor to see. With years of experience and thousands of successful procedures performed, you can trust your eyes to Dr. Imad Nakash. See Dr. Imad Nakash and his professional staff for your eye care needs. There's 2 locations to serve you. In Hazel Park, call 248-336-3937. 248-336-3937. In Rochester Hills, call 248-299-3937. That's 248-299-3937.
Kashat's Mediterranean Market and Shish Kebab offers a great array of your favorite Mediterranean meals. Meals range from lamb specialties, shawarma sandwiches, seafood dinners, and they offer special big trays of your favorite food, plus much more. Kashat's Mediterranean Market and Shish Kebab address is 32839 Northwestern Highway in Farmington Hills. Their phone number is 248-538-9552. That number again is 248-538-9552, and the supermarket is open from 8 a.m. to 9 p.m. Kashat's Mediterranean Market and Shish Kebab will definitely leave you satisfied.
Life is a nonprofit charity that's provided humanitarian aid and development to people and communities for over 25 years, regardless of race, color, religion, or cultural background. When disaster occurs here or around the world, Life for Relief and Development rushes in to provide food, medical aid, and shelter to those in need. Please help improve these efforts. Make your tax-deductible donation to Life now at lifeusa.org or call 248-424-7493.
Welcome back and thank you for being with us. This is really a serious issue in the community that we all need to work together, and we need a lot of awareness because this issue is still a taboo. People don't talk about it. You know, we hear about these young people dying and they say heart attack and they say this. You know, this is a disease. It's okay. We can say that someone overdosed. It has nothing to do with the family. It has nothing to do with the parents. Things happen. And if we continue to deal with it as a taboo, it's going to continue to grow. You know, Wayne County is one of the leading counties in the state, and the Arab American community, the numbers are staggering. So it's just amazing that we still don't really reach to it and, tell it as it is. We also need to educate as much as possible. Access is doing a great job. They have wonderful programs, but it's not enough. You know, everybody needs to work with Access, with the police, with the other organizations. There are a lot of other organizations that are really working to do something with it. The issue is we need to work together. You know, we need to involve the imams, which have been involved. And I'm really impressed to see all the imams coming into the meeting. And then I don't like to see what I saw last time is which they blamed it on the imams. You know, imams can't really, in all the mosques, they can't really do more than give awareness. It's not their fault, okay? We all need to work together. Something very important. We don't need to take our frustrations on one individual or one group of people. We all have a role to play. Parents have the number one role. They need to know what their children are doing. They can't blame it on anybody else. This is where it starts. It starts with parents. Is Hala with us this morning?
Yep, yes she is.
Good morning, Hala.
Good morning, Khalil. How are you?
Good. How are you? Hala Senora is from Life for Relief. Could you tell us a little bit about you and your organization very quickly, please?
Yeah, so I am the Public Relations Specialist for Life for Relief and Development, a nonprofit organization located in Southfield. And what we do is we help with humanitarian efforts, regardless of someone's race, cultural background. We respond to a lot of emergencies, such as natural disasters and people that are affected by wars, refugees, and whatnot. And I'm here today to discuss the stereotypes of, drug usage in the Muslim community.
What kind of activities have you been involved with, and what kind of services do you provide in regard to drug activities?
So at Life for Relief and Development, we do provide education support for, the youth and whatnot. We do have a community relations specialist that goes out and talks to a variety of communities all over the U.S. regarding the stereotype that we have in the Muslim community with the drug issue. And I think, unfortunately, in the Muslim community, we have a reinforced culture of shame for those who are facing drug issues, rather than, showing concern and compassion. And I think this makes it difficult for those with a problem to come forward and to get the help that they need to, recover and get back on the right path.
Absolutely. So do you distribute leaflets? What do you do exactly?
So we have actually created some posters and some just informational materials for, parents especially. As you said previously, it's an issue that the parents have to deal with. It's no one else that can really take care of the issue. And I know also for parents, it's not easy to face. A lot of times I think parents in the Muslim community tend to put shame on their child when they're facing this issue, and that's not going to make the issue go away. It's not going to make it better. Actually, it's going to do the complete opposite. It's going to make the child keep doing what they're doing. And I think, drug usage and abuse in the Muslim community has become very stigmatized for a lot of communities, disregarding the issue that's right in front of them. And many parents as well have turned, the other cheek, and they'd rather be in denial that their child has a drug problem. But when they decide to face it, it's not always approached in the healthiest manner. Many times they want their child's drug issues swept under the rug in fear of ruining the reputation of the family name. And to me, this is not a way to approach a drug issue with one's child. I feel, the healthiest way is to face the problem and come at it from a place of love and concern, and to seek help from those maybe even in the community. We have a lot of doctors in the community, a lot of psychiatrists and psychologists that, could help with this issue, and there should be no shame in it. But unfortunately, the Islamic culture has put shame on this issue and makes out that drug issues in the Muslim community do not exist. But I think we have to face, reality.
It's the Middle Eastern culture, not really the Islamic itself.
It is, yes.
We see the problem. Yeah, we see the problem exactly. It's a Middle Eastern issue because we see the problem across different, religions.
Exactly.
As you said, the Middle East.
My non-Muslim Arab friends, I have Lebanese Christian friends, and the same thing with their culture as well. It's
exactly
stigmatized.
Exactly. Something courtesy of the Middle East. Yeah.
Yeah, absolutely. Exactly. And I think that a lot of times, coming from the Arab culture, a lot of parents feel like, oh, this is a drug issue is not an issue that is faced in the Arab culture, but we fail to realize that yes, we may be Arab, but we're also human. And, any human being can be faced with a drug issue. And many of the Arab youth are growing up in communities where they're not only around other non-Arabs, whether it's at work or school, but they have to realize that, drugs are all around them here in the United States, and avoiding them isn't always easy, especially when it comes to peer pressure. And to me, I think the best way to make sure one's child isn't falling into this pressure is to talk to them, level-headedly and with love and understanding, rather than shaming them, because kids, as we know, they don't like to be told what to do and what not to do. But I think if, a parent approaches them, with a different place of concern rather than rage and madness, that shows, the consequences of the potential actions that drug usage can come, it can prevent the issue from taking over a child's life. And we see a lot of parents, they tell their child not to do this, not to do that, but the whys are gone.
Yeah, I know you haven't been with the organization long, but what kind of success have you had?
So I know that we have Abdul Wahab. He is our community relations director, and he helps a lot with going out into the communities and whatnot. And he's gotten very good positive response back, especially from the parents. I think a lot of the parents are raised overseas, and coming here, we have to look at it from their perspective. I know my father was raised overseas. It's not easy to raise a child in a country of the unknown, I say. It's fear of the unknown. And I think what Abdul Wahab has really done successfully is shown that, it's okay if your child has an issue. Your child doesn't make them any less of a person, doesn't make you any less of a parent. And I think he successfully has shown that, and he's actually approached it in a way to show ways that you can help your child to recover. And it's not, unfortunately, when a drug issue hits a child, it also affects the family. It's not just the child, it's the family as well. And I think he's definitely brought in that into perspective for families as well, and he's helped them to relate and to feel that they're not alone in a situation. And I have to give him credit for successfully doing that.
Thank you so much. If people need to reach you, how they can reach you?
So I can be reached at, my email is S as in Sam, A, N as in Nancy, YURAH. And then I can also be reached at my work phone number, which is 248-424-7493.
So is this the number for people that need help with regard to the drug issue?
Yes. So, and then I can also, if you would like, Khalil, I also can give you my cell phone work number.
Okay. Go ahead.
That is 248-320 9867.
Hala, thank you so much. I really appreciate it.
Yes, the first number I can use, Khalil, I'm sorry, the 248-424-7493. My extension is 3727 on that number.
Sounds good. Thank you so much. I really appreciate your being with us this morning and taking the time to be with us. Absolutely. Thank you. We're going to take a short break. We'll be right back. Please stay tuned.
Life is a nonprofit charity that's provided humanitarian aid and development to people and communities for over 25 years, regardless of race, color, religion, or cultural background. When disaster occurs here or around the world, Life for Relief and Development rushes in to provide food, medical aid, and shelter to those in need. Please help improve these efforts. Make your tax-deductible donation to Life now at lifeusa.org or call 248-424-7493.
If halal is important to your family, you can trust that Miramar will offer not only the highest quality halal products, but the best tasting and healthiest foods that can be placed on your family table with confidence. Miramar is the first and oldest halal certified food brand in America, serving the Arab and Muslim community, and offers a wide range of halal food products. Check out Miramar's halal food selection today by visiting Miramar's exclusive distributor, Ziad Brothers Importing, at www.ziad.com.
Rahma Worldwide Aid and Development provides humanitarian aid in several countries, especially in areas inside Yemen, Gaza, Syria, Lebanon, and Jordan, in addition to others in Africa and around the world. Rahma Worldwide provides food baskets, container shipment, medical supplies, mental health care, education, orphan sponsorship, soup kitchens, and more. Go to rahmarelief.org or call 248-990-4247. Any amount donated to Rahma Worldwide will go to sustaining many lives. Call now, 248-990-4247.
Are you going to start a restaurant or grocery store soon? Do you need floor plans and designs? Call Naji Abood at 734-744-9796. Do you want to buy kitchen and restaurant equipment at discount prices? Call Naji Abood now, 734-744-9796. New Concept Products and Design, the trademark of kitchen equipment. 5% discount on all purchases of $75,000 or more. New Concept Products and Design. New location, 31185 Schoolcraft in Livonia. Learn more at www.newconceptproducts.com. Call Naji Abood, 734-744-9796.
Welcome back and thank you for being with us. The number here is 248-557-3300. We're going to be switching to a different topic, and that is obesity. You know, if you notice, I was doing some research the other day, and I noticed that Americans are becoming more and more obese, and it is affecting our community tremendously. So we asked our friend, Dr. Ali Ashira, to be with us, and Dr. Ashira is a board-certified neurologist, and he is a diabetes and obesity specialist. He graduated from Wayne State University. He practices in Dearborn and Taylor, and is affiliated with Beaumont and Harbor Hospitals. Good morning, Dr. Ali.
Good morning, Mr. Khalil. How are you doing?
Thank you. Good, good, good. And thank you so much for being with us this morning. I know your
Thank
schedule
you.
is very busy, but I really appreciate you taking the time. So, what is obesity?
Obesity is a real problem. It's a real disease. It's a serious medical condition defined by abnormal or excessive fat accumulation in the body, which puts your health at risk.
And how do you define somebody, well, this person is obese and this person is not?
Well, sometimes we use a formula called the body
Okay.
mass index, or shortly BMI, and anybody can just use Google to calculate his or her BMI. There are a couple numbers you have to put there: your weight, your height, and then you come up with a number. And based on that number, we're able usually to tell if you're overweight, normal, or obese.
How common is it in our community?
It's extremely common. You know, obesity is now considered one of the most serious public health problems of the 21st century. And it's estimated that about 39%, almost 40% of adults in the United States are obese. And about 7.6% of them, they have severe or morbid obesity. So 40% are obese and about 30% they're overweight. So you're talking about 70% of our population, they have either obesity or overweight. That's 2/3 of the country. So that's why it's something very, very serious.
What's the difference between the two, obese and overweight?
The difference is, as I said, we calculate the BMI, and based on that number, we can tell. The normal BMI is anything between 18.5 to 25. So if you get that number between 18.5 to 25, you have a normal BMI. Between 25 to 30, that's overweight. And anything above 30 is obesity. And then we start classifying obesity: class 1 above 30, class 2 a BMI above 35, and class 3 obesity or morbid obesity for any BMI above 40. So if somebody has a BMI above 40, that's morbidly obese and should be very, very alarmed and take serious actions.
Absolutely. So what causes obesity?
Well, the obesity is most commonly caused by a combination of two things: excessive calorie intake, so excessive food intake, and lack of exercise, lack of physical activity. So bad diet and lack of exercise, those are the two most common causes of overweight and obesity. But sometimes we look for some problems, underlying problems, medical problems. There are some endocrine diseases like hypothyroid and some other endocrine problems that make you gain weight. That's why it's important to, if you're having problem losing the weight or you're gaining weight too much, to talk to your doctor and screen for these problems. And some medication can make you gain weight, like people who are taking steroids. They gain a lot of weight. And lastly, family history. But the family history is only 4% of the problems of obesity. Are only 4% contributed by the family history or genes.
It's basically, as you said, it's, most of the times the food we eat. Now, we can make some changes to really make a difference?
Absolutely. So that's the first thing we have to do is change our lifestyle to prevent the obesity and also to treat it.
Small steps along the way, as you say.
Right. So anybody who's trying to lose the weight needs to start with lifestyle changes.
Okay.
Diet modification,
now
exercise.
Mm-hmm. Yeah. Now, when you mentioned complications, how does it affect our body?
The overweight and obesity are the major risk factors for a number of chronic diseases, including diabetes, heart problems, cardiovascular problems, high blood pressure, high cholesterol, depression, and even put us at high risk of getting cancer. So that's why it needs to be treated.
So when we're talking about treatment, this is something that they have to come and see a doctor and then put a plan, or being evaluated. What are we talking about?
Right. So first, once again, everybody needs to start organically, meaning start by diet and exercise. Those are the first two things we have to do. Lifestyle changes. We start with the diet and exercise, and then if that is not working, or people who fail, to lose the weight by doing these two things, then we do have some medication that can help people lose weight. Talk about FDA-approved medication for weight loss. And that's the second thing we do. If that fails, then the last resort is doing surgery or bariatric surgery to help people lose weight. And generally, we do that in people with morbid obesity.
So you remove some of the fat that's in the body.
Well, we're not talking about bariatric surgery. Is not the cosmetic kind of surgeries that were like tummy tucks and alike. No, we're talking about doing surgeries to reduce the size of the stomach. There are many types of surgeries, like, for example, the sleeve surgery, gastric bypass, or we call it Roux-en-Y gastric bypass, where they reduce the size of the stomach, so people are not able to eat a lot, so they lose the weight. So they reduce the space where put the food in.
This really requires a lot of discipline to really change the way we eat, and it requires quite a bit of education too. I mean, I notice myself, if I indulge over bread and sweets, my waist gets a little bit tighter, and then I lay off of it, but it's not as easy as I make it sound. Is that correct?
Absolutely. It's not that easy. It's not easy at all. We all talk about the diet and exercise, but you're absolutely right. It's not everybody can do it, but like you said, it takes discipline. So everybody needs, whoever is listening, first thing you have to do is just calculate your BMI. Okay, if your BMI is above 30, then you have to be alarmed and start from today with your lifestyle changes. So everybody should be, cutting out all the junk food from their life. We should not be discussing about, junk food, the pop, Pepsi, juices, candy, ice cream. This is, in my clinic, when I talk to my patients, this should be eliminated. That's the first step, okay? Everybody should be thinking about the healthy food, salads, fruits, vegetables, fish, chicken. But at the same time, they have to think about the calorie intake. Not only healthy food, but we have to restrict our calorie in order to lose the weight. Like I had a patient that mentioned, like you mentioned, he said, "Oh, I'm not eating no bread, no rice, no pasta, no nothing. I'm just, chicken breast and fish." But then I asked him, how much you're eating? He said, like, I'm eating 4 or 5 pounds of chicken breast. That's a lot of calories. So even though he's trying to eat healthy, but he's putting too many calories. That's too much. And your body, if you're eating this amount of calories and you're not burning, everything turns into fat. All these macronutrients, whether are carbs, fat, protein, if we're not burning them, all the extra calories, they turn into fat, and we accumulate the fat as, and we become obese.
Absolutely. You kind of answered my second question. Is what's the best diet to lose weight?
Well, that's a very, very good question. I get this question a lot in my clinic. People ask me what they should be eating and what not. And I tell them, the studies actually showed that any diet works. Any kind of diet for weight loss works. Whether it's a keto diet, a DASH diet, Atkins diet, a Mediterranean diet. I tell them, I don't care if it's a low carb, high fat, high protein diet. The key, as we mentioned, it has to be a low calorie diet. Because like I said, if you're eating only chicken breast, but you're eating too much, that's a lot of calories. So you have to restrict your calorie intake. So the answer is any diet, but it has to be a low calorie diet.
Yeah. So when we're talking about calories, like how many calories is recommended, or it depends on the size of the person?
Of course. I mean, some people if somebody comes who has a 400-pound body weight, then going down to 800 calories a day, that's impossible. They're going to be very, very, very sick. So it depends on the body, but usually I don't recommend no more than 1,500 calories a day in order to lose the weight. So between 1,200 to 1,500 calories a day should be enough for you to start losing the weight.
I'm sorry, how many calories?
1,200 to 1,500.
Okay.
So the key is, in order to lose 1 pound of fat, your body has to burn 3,500 calories. So if we're talking about, if you want to lose 1 pound every week, you have to be in the negative calorie balance by 500 calories every day. Times 7, that's 3,500. So this is how I tell my patient to lose 1 pound every week. And this is what the guidelines recommend. Losing, at least 1 pound a week, you'll be good.
Yeah.
Some people ask me to lose more than that, but I tell them one pound a week, if you manage to do it, you're good.
Losing it slower is better than losing it fast. Do you agree?
Absolutely. That's a fact. I mean, a lot of patients come to me. They say, "Doc, I want to lose this 30 pounds, in 1 month." I say, it's not good. I mean, you could do it, but it's not healthy. All this weight that you gained over the years, don't expect to lose it all in just a few weeks. So you have to let your body lose the weight slowly, and the key is to be patient. And 1 pound per week. If you calculate this, 1 pound per week, in a month you lose 4 to 5 pounds. In 3 months you lose between 12 to 15 pounds. 12 weeks, 12 pounds, and then you start setting. The key is setting small goals. If you put small goals, you're able to achieve the big one.
Absolutely.
Right. Mm-hmm.
Is there anything I haven't asked you that people need to know?
Well, I think you asked all the important questions. I just want to add that whoever is listening, just start today, calculate your body mass index, your BMI, and start your lifestyle modification. Change your diet, start doing some exercise, and if you think you need some help, we will ask your doctor or come to our office. We could help you. We run the obesity clinic, and I'm board certified in obesity, so we help people lose weight, and of course we screen for underlying medical problems that can
How can people reach you?
Well, our number is they can Google it, Google our office, and the phone number is 313-600-4669.
Dr. Ali, I really appreciate you taking the time to be with us, and this is really a great information, and we hope that we inspire some people to start look up these numbers and then start on the healthy way, because health is the most important thing.
Absolutely. Thank you so much. Thanks for having me.
I appreciate it.
Have a great day.
Okay, absolutely. Thank you. Yeah. And I want to thank Chief Haddad for being with us. I also want to thank Mona Makki, Miss Makki from Access, Hala Sanura from Life for Relief, Dr. Ali Ashira from his practice in here in Dearborn and in Taylor. I want to thank our great listeners for being with us this hour. Also, I want to thank Mike for producing and doing a great job as always. I'm sorry, Jerry, we couldn't take you on today, but we ran out of time, and you came until us late. You're normally much earlier than that. We promise we'll take you next week. I also want to remind you that Don't forget the housing market is pretty good. You're looking for a home, for business, for commercial. Give me a call 313-819-0101. Thank you so much and have a wonderful and safe weekend. Again, the number is 313-819-0101. For more information, log on to yamichigan.com. Again, yamichigan.com. Have a good weekend. Bye now.